Now we move on to our second part of the Islamic Medical Conference. Our moderator for the last two sessions is a graduate of Doctor of Medicine at Matias H. Aznar Memorial College of Medicine at Southwestern University in Cebu. She spent her pediatrics residency at Zamboanga City Medical Center and had her fellowship in pediatric endocrinology and metabolism at Philippine General Hospital. She is a diplomate of the Philippine Pediatric Society, and she is currently a medical specialist 3 at the Newborn Screening Reference Center at the University of the Philippines, Manila. And she heads the Newborn Screening Continuity Clinic for Region 9 and Basuta provinces. She is also the concurrent auditor of the Unified Muslim Medical Association. Ladies and gentlemen, let us welcome Dr. Mirasol Sinangote Elyong.
Assalamu alaikum rahmatullahi wa barakatuhu. Thank you, Dr. Istorco, for that kind introduction. Welcome to the fourth plenary session, Milk Banking and Islam, of the first Virtual Islamic Medical Conference. And it is my pleasure to introduce to you our first speaker for the fourth plenary. She had her diploma in obstetrics and gynecology from MCH Riyadh in collaboration with Queen Charlotte Hospital and University of London. She is a member and a fellow of the Royal College of Obstetrics and Gynecology, London, United Kingdom. She is also a member of the Arab Board of Obstetricians and Gynecologists. She is a fellow on infertility, IVF, and reproductive endocrinology, and had her fellowship subspecialty training for reproductive medicine at the Chelsea and Westminster Hospitals, London, United Kingdom. She also had her fellowship in minimal invasive surgery at the Leicester Hospital and the London Clinical Hospital, United Kingdom. She had her master's in research in reproductive and developmental biology at the Imperial College of London, UK. She is an international board certified lactation consultant. She is a WHO and UNICEF certified trainer for breastfeeding advocacy, a certified external assessor for baby-friendly initiatives, and a member of the Academy of Breastfeeding Medicine USA. She authored several scientific publications and posts. She held many medical positions and member of different distinguished medical societies. MashaAllah. Indeed, she is an expert to talk on human milk banking strategies in Muslim countries, its obstacles and alternatives. Let us all welcome Dr. Hanan Ali Sultan.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for your introduction. And it's really my great pleasure to be part of this very, very prestigious conference, which is really one of the best conference. And I think every Muslim doctor need to share on such, and whether as a speaker or as an attendee. My talk will going to be about human milk banking strategies in Muslim countries, challenges, obstacles, and alternative. In the coming 45 minutes, I'm going to introduce a human milk banking principle worldwide. What is their indication and the need for the human milk banking? What are the challenges and barriers in Muslim communities? Some experience of the bank in different Muslim countries and communities, what is meant by milk kinship in Islam and why fatwa differs with different countries, how to overcome the obstacles and the barrier in Muslim world, strategies to establish human milk-based industry in Muslim world based on some successful experience and alternative, such as the NGO supports for the orphans, and then we are going to conclude my talk. So to start with, Human Milk Bank follows strict safety guidelines based on science. So it's everything is evidence-based. I'm talking about worldwide milk banking. Donor human milk is dispensed by the priority. Like for example, if I have milk, I need to serve it for the sickest babies first. Human Milk Bank established in 1909 in Vienna, Austria, And in 2 years later, it's been the second and third milk bank was in Boston and Germany. After almost 100 years now, in 2019, there is more than 600 human milk bank worldwide in more than 35 countries. And as you can see here, more than 100 bank is present in the Norwegian part and in Italy, and about 70 to 200 in the South America, and also here in South Africa, while between 40 to 70 in the north part here, and in Austria and some part of Europe. And if you can observe, the white one even is not exist in the Arab country or in the Islamic country. And I'm gonna highlight more about that. Human donor milk worldwide in the country, as I said, probably here, which is really important for us. In Kuwait, they are having one bank which was established recently, and it's present in the NICU. Like here in Central and South America, there is about 300 bank in North America. By 2012, there is a 12 distributed in USA and Canada, and these milk bank is work as a global network, and they can distribute the milk everywhere in the world. In Europe, we have around 166 bank, and the operation, how this human milk bank work. First, the milk is produced either by hand expression by the lady or through electrical pump, and this is mainly in the developed country, or the lady might go to the milk bank to pump daily. The location, they are either present in hospital, like in the NICU, or in the food service department, or in the blood or tissue banking, or in the community. Normally, it's regulated by the government. Who's the staff in the milk bank? The milk bank has to have a director and a coordinator who usually having an IBCLC, which is a lactation consultant certificate. They need to have a supervisor, donor recruiting and screening, milk processing and dispensing, which is normally a trained technician, a medical director, which is normally a neonatologist or advisory committee, by the clinical decision and oversight milk bank operation. The regulation, like in differ from country to country, like in Brazil, France, Norway, and UK, it's regulated by the Ministry of Health. In USA, like Canada and Italy, they have a professional organization or general tissue banking guidelines. The cost normally is non-profit. The charges to cover the cost of the donor screening and processing of the milk might be done. For example, France, but the Ministry of Health, they said 80 euro per liter. In USA, it might cost $3 to $5 per ounce, and in Canada, 1.2. So it varies from one place to another regarding the cost, but the cost normally only for the donor screening and the processing, not for the donation itself. The screening program is differ from developed countries, from the developing, of course. In the developed country, serum screening for HIV, hepatitis B and C, and syphilis, and the cost not by the donor. While in the developing countries, because of the high cost and the milk is vital for the morbidity and mortality of these infants, they normally take a verbal and a written screening to rule out high-risk donors. They don't do a test normally. And heat treatment, they use it to kill the viruses. Medical checkup is normally run by the donor's physician and her infant's physician. Some perform examination to the mother and her infant. So each milk bank run their policy and the procedure. All donor milk screened for the bacteria before dispensed, stored in refrigerator, and they frozen at 20 till they disbanded. Freezing preserved all the nutrition and immunology and hormonal property, but do not kill the pathogens. If you want to kill the pathogens, you need to heat it, like in the developing country. Then hold the pasteurization at 62.5 degree for 30 minutes after center container reach the temperature. And this methods of pasteurization is well known to reduce the bioactive components, and I'm going to talk about it later on in details. Donor milk records allow tracing of the milk from donor to the recipients. It includes donor screening profile data on each batch of milk screened, processed, and dispensed, and the record is made including processing and bacterial screening, and the record is kept till the recipient reach the majority up to 3 years. Although in most of the places we give the milk to recipient up to 2 years, but according to the cases. This is what I was talking about, the bioactive material which might be affected by the pasteurization. The IgA and the SIgA is normally preserved after the pasteurization up to in 67 to 100%, while the monoglyceride and the linoleic acid, alpha-linoleic acid, they are preserved totally 100%. The lipolysis of the lipoprotein lipase enzyme and the IgM, which is normally not exist, become zero after the pasteurization, while the IgG and the lysosome between 60 to 75% present. The human milk banking, the WHO resolution in 1980, they say that donated milk is the next best option for mothers who cannot breastfeed. So breastfeeding come number one, and after that, not the formula milk, but it's the human milk. Human milk bank established outside the Muslim world, as I said in the first slide, where they collect, screen, process, and dispense the milk by boiling of all donated milk together. So they boil all of the donated milk together. We'll talk about the donor human milk, how now all the milk which comes from different donors, they put them all together, and they believe that this will give better immunity for the babies, especially the preterm babies. So pooling multiple donors' milk is because of the human, why they come from this ways, or the concept of this is because the human milk composition is dynamic. It changes over the course of the feed itself, over the course of the day, and over the course of the lactation, the time. To limit the extreme variations of the quality of this milk, so the bank, they take all the donors' milk, they pool it. And for example, in USA and Canada and France, they are doing this very regularly. But in Sweden, they are objecting this. They don't do the pooling. Milk bank donors are typically anonymous, and the donation are often combined, both. And because of these two factors, that the donors has to be anonymous, and the pooling of a lot of milk, that is rejected in most Muslim worlds because of the mixed lineage, and that's why most of the Islamic country, they did not establish, or they were reluctant in accepting this idea. The advantage of pooling is the boost of the immunity, particularly for the preterm babies, and they said the best is if you pool from 3 to 4 donors. This is the minimum you need in order to reach this effect of good things of the pooling. And to optimize the bioactive components, if you remember, of the IgA and insulin concentration, and limit variation over time. The disadvantage of the pooling is that if infection happen on the bank, you cannot trace the source. This is a very nice paper which was published last year in October 20 about milk bank pooling practice, impact, concentration, and variability of bioactive components. What they conclude from this paper is that increasing the number of donors, as we said, 3 to 4, included in the pools, may help optimize bioactive components delivered to preterm infants, particularly the IgA and the insulin component. And it may help inform milk banking practice to decrease the compositional variability in produced milk pool. Also, the bulls with only what they found in this paper, if the bulls contains only one donor, it had lower total IgA and lower insulin, and this is a significant one when they compare it with at least two donors. Increasing the number of donors in a pool decreased the variability of the total IgA, and again, this is a significant one. So, unfortunately, they did not look at the milk postpartum age was not recorded when the pooling occurred. As we said, why it's important for this, or who's the target for the milk bank, is our tiny preterm babies or very low birth weight babies. And this is from evidence-based research. As we said initially, the WHO and UNICEF recommended pasteurized human donor milk if the parent's milk is not available or not enough. Why? Because there is a difficulty to initiate breastfeeding after birth or struggle to continue for longer time in these tiny preterm babies. Their immune system is not yet fully developed, and they are vulnerable to the infection, especially the NEC or the bacterial necrotizing enterocolitis, which causes sepsis with high mortality and long morbidity because of the short bowel syndrome, poor neurological and motor skills development. And also the donor human milk, they found that they reduce, if you use the milk of the donors, it reduced their hospital stay and it improved their morbidity and mortality. The formula milk, it's found to be increase the NEC. There's a Cochrane review from 5 RCT for where they include the preterm and very low birth weight, and they found that the necrotizing colitis is 10 times more when formula fed versus the human milk. This was published in 2007, and the donor human milk versus preterm formula, even the preterm formula, they found it not as good as the donor human milk. What are the ethical concern and the barrier not to establish this really very good in terms of medical benefit? As I said before, lack of an anonymity of the donors and the pooling, the necessity to pool donor milk together, and these will be leading to difficulty in trace the kinship. There is a lack of an international framework to help set up local regulation worldwide, generally speaking. So the Muslims world really urgently now to need to set up protocols, discuss alternatives, and set regulations and strategies in order to fulfill this important part. What are the challenges? As I say, inherit a milk donor genetic. One of the challenges is that the milk donor's genetic materials transmit genetic and epigenetic disorder, especially if breastfed was regular, and this may share similar gene expression and epigenotype on the babies. What are the milk kinship requirement in Islamic law? The witness need to be known identity, and pubertal age is not important, but the marital status is really important. And this milk, it contains 3 components for the milk kinship to happen. We need to have a witness, we need to get an information about the milk, and the recipient. The recipient, the baby, has to be less than 2 years. If more than 2 years, it will not considered as a milk kinship. The milk need to reach the baby's stomach either by 2 ways, either through sucking, by direct breastfeeding from the mother, or through the bottle, or through spoon feeding. The number of the feedings, and I'm going to talk about this in more details, the number of feeding of the session has to be 3 to 5 times, although some scholars, they might accept 1, but majority of our scholars, they will take 5 times. The quantity the baby should be satiated at different feed, means he should be really shaban, make full stomach. The milk kinship in Islam, it's a bond that created through breastfeeding between the parent's child when a woman gives milk to a baby who isn't biologically related to her. The bond prohibits marriage. The man cannot marry the woman who breastfed him and certain of her relatives, like mothers, sisters, and daughters. The recipient will be her son, and all her children will be his or her sisters and brother. And this is what we call a milk sibling or al-ukhuwa bil-rida'a. Now I'm going to talk about some human milk bank experience in Muslim countries. The Human Milk Bank in Muslim countries, first one announced was in July 2016 in Iran, and it was published in the European Milk Bank Association website in 2020. But unfortunately, till now, there is no obvious policy till 2021. I only found this publication by Ong in August 2021, where he talked about the Iranian experience of the Human Milk Bank. Iranian Sunni believes, which is the minority in the country, they believe that one feeding of donated milk leads to kinship. While the Shia, they believe that milk kinship comes only through sucking of the breast milk. So if the woman does not, if this donor milk was taken not directly from the woman, they are not considered as milk kinship. And it must be at least 15 sessions, not like we believe of 5 sessions. Feeding the donated milk by spoon, bottle, or special tube, and the milk is a mixture from 3 to 4 donors, is not considered like kinship, will found. And they also have a global network that spans more than 750 milk banks in nearly 70 countries. They are in collaborating with them. While in Singapore, for example, they launched a milk bank in 2018, although only about 15% of the citizens practice Islam in Singapore. Singapore is a multi-ethnic and multicultural country. There's a fatwa granting permission for milk donation when medically indicated. And based on this, they opened the milk bank in 2018. In Malaysia, 3/5 of the population is Muslim, aiming to open its first milk bank under the MOH by 2025 soon. And milk kinship is not an issue because they are planning to follow the Sharia compliant of the human milk banking. Turkey in 2013 and Bangladesh in 2019, they came close to opening pilot milk bank. Turkey accepts up to 3 donors and 3 recipients, but should all the identity to each other. This is what they plan to. In Indonesia, where they have a world's largest Muslim population, they are planning to open the country first milk bank in coming years. And in stockholder discussion right now, they emphasize how milk will come from single donors. So I think they will follow Kuwait, which I'm gonna talk about it now. The experience of Kuwait milk sharing activity in Al-Aidan Hospital. This paper was published in 2000 by Al-Najib, who's a neonatologist, which has established the milk bank in Kuwait. When they published their experience in 2000, they said that they established the breastfeeding by starting education in the antenatal period, because really this is, I'd like to emphasize, because I'm an obstetrician, and I think every obstetrician in the world need to, because normally breastfeeding and the important and the encouragement of breastfeeding is done by the family physician or by the pediatrician, and especially the neonatologist. But I think that will deal with the baby only, but not with the mothers. All the obstetrician in the world, they need to know about this, and they need to talk to their ladies during the antenatal period and prepare them for the breastfeeding and see what is the obstacles, what are the challenges. And I'm really proud that I was the first consultant obstetrician in the kingdom that I had this degree of IBCLC, and I start encouraging all our obstetricians to do that, because if you look and see how important is to prepare the lady during the antenatal period. Unfortunately, when they look in Kuwait about the program after a couple of years, they found that 32% only of their preterm infants did not breastfeeding. So it's really important that we need to reduce this number to at least less than 5%. Tailored donor scheme, they allocating what in Kuwait they are doing in their bank, milk bank, is they are allocating single donor for each baby. Why? Because it's easier to trace the milk kinship. A donor and a recipient parents meet prior to the exchange, and they know each other identities, and then they will sign a paper. And after the donation, both families receive a certificate detailing their names, contact information, how much milk was received, and how it was dispensed, and the number of the feds involved. This paper was published from Al-Najib again this year, a couple of months ago. It's really a nice paper, and I think everyone interested in this subject need to go through it. They introduced something called ambulatory human milk donors, an innovative solution for human milk banking in Muslim countries. The parent responsible to find a single donor, again, why I'm stressing on the antenatal period, because unfortunately what they found that with their bank, they only give the services to less than 10 babies, maybe few babies in the year. And in order, because of the lack of the donors, people were reluctant and they are not donating the milk. So they're starting this from the antenatal period. They talk about it to every woman in the antenatal periods, and the parents normally responsible to find this single donor. If failed, they go to the NICU staff. They will find out for them. The eligible donors is available. If the eligible donor is available, they exchange the consent and the donor volunteers without any payment. Serological test is done, and then expression of the milk. They might freeze it for 72 hours. And as I said here, with this program, only 2 to 3 preterm babies per year is benefit from their bank. Then they did a survey in February 2019. They included 200 ladies. 75% of them, they were Muslims, and 25% they are non-Muslim. Interestingly, the non-Muslim believe more than donor milk better than the formula. So this shows us how much we need to work, especially on the Muslim community, to tell them about this during the antenatal, and community teaching is really important. 61 out of the 149 of the Muslims, they refuse to donate. This again show us how we need to educate our Muslims people, plus the concern that milk is insufficient for their own infants, so they don't want to share it with another baby. Human milk donor recipient perspective, non-Muslim participate accept the idea more than the Muslim participant. The concern of human milk safety and the inability to accept Muslims women, while non-Muslim mothers who refused to receive donor milk had concerns of human milk safety and faced family disagreement. So to improve the policy, time factor to allocate the donor postpartum was really a major issue in Kuwait Al-Adan experience. So they started the education at the antenatal clinic, as I said, and counseling, especially those with a preterm baby's risk, to accept the human milk donor over the formula and make donors' milk to be readily available before birth, arrange own donors, assist from location team if failed to get the donors, and they go through the best place to find this is the lactation clinic, is the best source. And in January 2020, audit was made to evaluate the new policy of the ambulatory process. And this is the flow chart, how they did it, and make the ambulatory is ready for the woman. So any woman who start to all of a sudden, as we know, preterm labor is unpredictable and it can happen anytime. And at that time, by the time the family will find someone to donate for them, the baby might die. So this is really, I think, one of the good thinking of that. We'll move now to human milk bank and wet nurse regulation and experience in Saudi Arabia. We don't have a human milk bank in Saudi Arabia, but wet nurses are encouraged. In March 2021, the government of Saudi Arabia Ministry of Justice established an official registration website to record all milk kinship, and I think this is really, really a very good thing is done, and a certificate is issued now for the wet nurse mother witness to be registered as well in this website. So it's really become now more easy, and even it will help in order for the donated or encourage more the wet nurse to be. The first conference fostering baby-friendly community conference was done in Jeddah in November for 3 days in 2019. And during that conference, there was one scientific session about breastfeeding provisions between Sharia law and science. 3 distinguished speakers, I'm really proud of them. Dr. Amalat Tawil, she's the regional network coordinator for the Middle East of Academy of Breastfeeding. She presented milk sharing and Islamic and scientific view. Professor Khalid Abdurrahman, who's a family physician consultant and the former president of the Saudi Scientific Society of Medical Jurisprudence, present breastfeeding provisions in Islam. And the distinguished, really, Dr. Mona Sumay, I'm so grateful for her, from Kuwait. She's the president of IBFAN Arab World. She presented the experience of the only Islamic bank in the Gulf area at Al-Adan Hospital. And as a conference director and chair of the scientific committee, I'm so proud that we did the conference recommendation and we presented to the General Directorate of the General Administration of the Nutrition at the Saudi Ministry of Health. And this is my report of the recommendation, which I sent it. And in the recommendation, I put that to establish a milk sharing program, not bank, that fulfill the Islamic law for milk kinship and preserve the lineage. We plan to visit Al-Adan Hospital, and the visit was arranged to be in March 2020. Unfortunately, that was not happened till now because of the COVID-19 pandemic was started immediately after that, and I was at that time held in UK for a couple of months. On the same conference, we invited Without Charity Foundation or Association, where they share with us the really very good experience how as an NGO, as a non-governmental organization, to support of the orphans in the Kingdom of Saudi Arabia. Mrs. Fatin Al-Yafi, she's Without Charity Foundation presenter. She gave her experience. She gave us a presentation on the offering breast milk for the orphans through adoption program. Udad NGO is established in 2008 to accommodate orphans, arrange for adoption, milk kinship, and they follow them and check and raising their awareness on the community. The adoption requirement, the family should be a Saudi, and they consist of 2 spouses. Wife should be less than 50 years, priority for the child's family. If the family has children, they should not be more than 3 before below 6 years, so they can look after this adopted child. They need to pass medical test. They need to have matching skin color as well as facial and body features. Researchers also should prove the validity of the foster family from the psychological, social, and economic aspect for the care of this orphan child through the use of special criteria. And this is really a mandatory that breastfeeding is a must and the main condition for this family who's going to adopt this baby. It's a prerequisite as a right of an orphan child who lacks parental care. The social worker to start with, how the breastfeeding process or arranged before the family is taking this adopted child. The social worker has to explain to the wife and foster family how to stimulate the breastfeeding. They refer them to lactation consultant to induce the lactation, even if the wife never have a pregnancy before. And we have really a special program for that, and we got really a good success rate in some cases. Establish milk kinship between the baby and the foster family, as I said, either through lactation from the wife herself or one of the relatives of one of the families. Breastfeeding at Widad headquarter, if they allocate whether the wife or the witness from either of the relatives, they should come in Widad headquarter for 5 different sessions and do the breastfeeding directly from the wife or the nurse in front of them, and they register that. So in order to use it in the court to prove about that this adopted baby now or child is one of the member of this foster family. It's important to choose the sex of the baby to be adopted, and I'm going to talk about this more. The witness sign a pledge and confirmation that she's going to do this for 5 different sessions. Breastfeeding either directly can be done or by the spoon, because as a Sunnah people, we believe that both ways will be a milk kinship. So either breastfeed directly or by spoon or by the bottle. Breastfeeding in the presence of witness from the foster family and under the social worker supervision at the adoption department to facilitate the insurance of the breastfeeding instruction from the court. Breastfeeding documented in the breastfeeding endorsement form and kept in the registry of Widad charity. Based on the fatwa from Sheikh Abdullah al-Muslih, stating milk breastfeeding or the quantity that the baby will reach to the ishba is 120 ml of the breast milk. This is, as I said, direct from the mother breast will be calculated by sucking of the. If the woman, this is if you are giving it by the bottle. If the mom or the witness is breastfeeding using suckling from her breast, according to the fatwa, that if the baby is breastfed and then leaving it, taking the breed, this is considered as one breastfeeding session. And I'm going to talk about this, show you the written fatwa for that charity in this matter. In case of bottle feeding, will be considered as a breast, as I said, and given that breastfeeding is done only after medical referral from the witness and appearance of the analysis result. Means I know that in Islam originally we don't have all of this, like if you remember, any lady who used to be sick or they want to do a witness, they normally don't do any test, but because this is an organization and they want to be responsible and as following also the donors scheme worldwide or the witness, so they need to be screened as well and make sure that there is no any disease or anything that they might affect the baby. This is the fatwa which comes from the President of Council of Senior Scholars, CSS in Saudi Arabia, to Widad Association. That was about 3 to 4 years ago. It was, I'm going to read it in Arabic quickly and then I'm going to translate it in English the summary of it. من عبد العزيز بن عبد الله بن محمد آل الشيخ إلى سعادة مستشار جمعية الولادة الخيرية بجدة. أشير إلى كتابكم المقيد في الأمانة العامة لهيئة كبار العلماء برقم وتاريخ الذي تسألون فيه عن القرابة للمرضعة التي تحقق شرط المحرمية للزوج إذا كان الطفل المحتضن أنثى، وللزوجة إذا كان الطفل المحتضن ذكرا، إذا تعذر رضاعه من الزوجة سواء كانت المرضعة من عائلة الزوج أو من عائلة الزوجة. وأفيدكم بأن اللجنة الدائمة للفتوى درست الموضوع وأصدرت بشأنه الفتوى رقم وتاريخ، وفق الله الجميع. this is the فتوى. الحمد لله والصلاة والسلام على ما بعد. اطلعت اللجنة الدائمة للفتوى على ما ورد إلى سماحة المفتي العام من مستشار جمعية الولادة الخيرية بجدة والمحال إلى اللجنة. والسؤال نفس الكلام اللي قلناه، في حال عدم قدرة الزواج على الإرضاع يتم الاستعانة بمرضعة من عائلة الزوج أو عائلة الزوجة، وذلك لتحقيق شرط المحرمية. What they said here is that if the wife cannot do the إرضاع or the breastfeeding, you can have a relative either from the wife or the husband family. نرجو من سماحتكم إفتاءنا في شأن بخصوص درجات القرابة. وبعد دراسة اللجنة الاستفتاء أجابت بأنه إذا تعذر الإرضاع من الزوجة وتم إرضاع الطفل أو الطفلة قبل تمام الحولين من ولادتهما, here they said that the baby has to be less than 2 years as everyone knows من إحدى قريبات الزوج من أصوله كأمه أو جدته، وكذلك إذا رضع من أحد أخواته وكان الرضاع محرما وهم 5 رضعات فأكثر في الحولين. Again here they insist that it should be at least 5 sessions in the first 2 years of life of this adopted child. فإن المرتضع يكون من محارم الزوج دون الزوجة. أما إذا رضع الزوج من فروع الزوجة, I'm gonna say that in the last summary. And here again everything I'm gonna say it here probably in English, it's easier. This is the fatwa from the Council of the Senior Scholars in 1439. The adopted family, there are 3 ways, 1, 2, 3. The first one and the best is that the wife will be doing the breastfeeding. It has to be 5 times and the baby has to be in the first 2 years of life. If this happens, milk kinship will be to both parents, means the wife and the husband is going to be his parents. Number 2, if the husband relatives, will have 2 parts. If the relative is the origin, or they call it usul, means mother or grandmother or sister of the husband, then the baby will be mahram to the husband only, not to his wife. And this is important. If the family wants to have a baby girl, they need to choose a relative from the origin of the husband. Is that clear? I hope it's clear. If the wet nurse is a branch relative of the husband, like husband daughters, granddaughters, daughter-in-law from same wife or other wives, then the adopted child will be mahram for both of them, for wife and husband. So this is really important to understood. So if we are, the family come and say, I want to adopt girl, we give them two option. Either the witness has to be an origin relative of the husband or from this. I'm going to talk about that later. If it's a boy, they can have from this too. And the best is to have from the wife. The third option is that if the wife relative is going to be the witness. Any question? Any question? Hello?
Hello?
You can hear me?
Yes,
sorry.
Dr. Hanan, loud and clear.
Okay, sorry. If the witness is the wife relatives, if she's from the origin, again, mother, grandmother, sister, niece, then the baby will be mahram for the wife only. And this is very good and excellent if she's adopting a boy, because if he live with the husband, it's okay. what we need is the wife. So in order to be her mahram, she need to choose a witness from one of these origin relative. If the witness is from the wife's daughter, niece, if the from the branch, like the wife's daughter's niece, daughter-in-law from same husband or previous husband, then the baby mahram will be to both wife and husband, and this is again good for the girl. So we have three options to choose from. I hope it's a little bit complicated, but normally the everything will be like in several session, and they counsel the family clearly. And sometimes, like if the family comes and say, I want to adopt a baby like this, so they explain to them, and then we'll go and look who's from my relative is available and accepting to be the witness, and then they come to them and tell them the option, and then they choose for them a baby boy or a girl according to what witness is available to them. I hope this is clear. We'll talk about now some fatwas. The first fatwa from the OIC, which is the Organization of Islamic Corporation Legal Arm, which was in 1985, they forbidden donor milk bank to protect the lineage of the children. And also the European Council for Fatwa and Research, they give as well a fatwa about that. Each Islamic country has its own local fatwa center. To protecting lineage is one of the 5 obligations that must be protected in Islamic law. Therefore, any actions or behaviors deemed detrimental towards lineage or descendant must be avoided. The ruling regarding the establishment of human milk bank are closely connected with the law of marriage prohibition, whereby infants who suckle from one or multiple women create kinship relationship similar to blood relation, which prohibit marriage when the outlined conditions are met. The majority of scholars consider that a baby is legally a nursling either through direct breastfeed or indirect feeding, as we mentioned before. We call it milk sharing initiatives, not milk bank, as sharing bears more the human touch and human values. Mothers should be encouraged to breastfeed. These are to overcome these obstacles. These are my recommendation. Mothers should be encouraged to breastfeed their babies, especially the preterm. Start expression within 1 to 2 hours after birth, 7 to 8 times, especially in the night. Limit milk sharing for prolonged period to those who failed, or the preterm babies or mothers with medical contraindication to breastfeeding, such those with HIV or any other medical diseases that prohibited breastfeeding, or mother who passed away. These are, again, recommendations from the WHO and UNICEF 2020. The donor and her husband have to mutually consent to donate the milk. The collection of donor milk must be verified by Muslim healthcare professional. The human milk bank must comply and meet the strict standard and requirement of Islamic family law to prevent the overlapping of the relationship between the recipient and multiple donor, of one donor and multiple recipient. Only one donor per child, no mixing of donor milk. We have like options. So this is one school, they will go for this. Full identification of the donors by adequately labeling of all samples. This is very mandatory. Disclosure of the identity of the donor to the recipient and his family. Both donors and recipients should consent to such disclosure. Name, address, identity, card number of the donors could be attached to the childbirth certificate. The quantity of the donor's milk distributed to a recipient from a single donor must not exceed the quantity required. This is another option that you might, like I said, playing of the requirement of the milk ship. If we knew that 120 is the amount, or ishba is the one to be considered, some country, they will go and reduce this so it will not exceed the quantity required. So milk kinship will not occur. Or they bore donors 50 to 100. So the amount of the milk from each recipient will be very little. or no more than 3 to 4 feeding session will happen, so they will not fulfill the requirements. I'm not sure about whether this is accepted, and I hope we can hear from our next speaker about this. We need to ensure if fatwa about this as a solution exists. For donors who are willing to give her milk more than 5 full feeding for one recipient, the infant then become a donor son. This is like what the normal, what we know it, and we talk about it. The strategy to establish human milk bank in Muslim world, best interest of infants and children while respecting the tradition of milk kinship, to have milk banks. This is our strategy, has to be to have milk bank, a milk or sharing, a milk kinship must be established with the donors. Milk from just one known donors, as I say, maximize the number of donors. As I said, this is another option. Strong social network to obtain. This is really important because, as I said, what they are doing in Al-Adan, the ambulatory donors, strong social network to be established in Muslim countries, and probably we can have it all through the Islamic communities. Possible harm, transmitted disease screening program, screening of the witness mother. We need to establish this. More research of the technicalities of Islamic disclosure, how reality will change disclosure, survival of the preterm infants. We need more researches to be done. And with growing, this is really an important aspect I found. Like, we are not talking about Islamic countries, but also now Muslims is, alhamdulillah, living in all the world. And there are some countries, non-Muslim countries, but there are a lot, and sometimes they are minority or moderate or more of Muslims community in these non-Muslim countries. And with the growing number of them in the Western countries, there is an increased need for the human milk donation that meets the Islamic ruling to be accepted by those families. And I really feel sorry for them because they are like isolated and they need our help to establish a strategy all through the Islamic country. And to conclude, I will say that human milk is critical for the newborn health, particularly preterm and low birth weight babies. If the mother milk is not enough for the baby who is less than 2 years, human milk sharing can save their life. This can be arranged by a milk sharing program that complies with the Islamic regulation of milk kinship in form of mahram. Single or multiple witness may be arranged by the parents. Official document certificate by government to prove milk sibling and kinship according to Sharia law as it's been established in Saudi Arabia. Single, multiple milk sharing program can be arranged by lactation consultant according to Islamic law. And this could be either in the bank or in the NICU hospitals. The key pillars for human milk bank sharing program in Muslim communities should include safety and compliance with local and national Sharia law. It has to be universal in Muslim communities as much as we can, so we can use the network for that. Al-Adan Hospital experience raising awareness by ambulatory program is a model for Islamic communities, and some countries they may need modification to include 3 to 4 donors, and provided that there's an acceptance by these family, and these need after that to have a researches and education for our Muslims communities. Network and information sharing, advocacy and promotion of all breastfeeding mother and sustainability of donors' milk supply are critical. A mother-baby friendly integrity approach is mandatory with the aid of an IBCLC consultant. There's an urgent fatwa needed now to confirm the amount of milk to be considered as saturated, whether it's 120 ml, like what Sheikh Abdullah Muslih said, whether multiple donors pooling of less amount, less than 120 ml of milk per donor is appropriate to be in human milk banks to avoid the mahram milk in preterm babies as a possible solution in Islamic countries, and whether a use of maximum of 3 to 4 donors per child, particularly those preterm, where there is a necessity, medical necessity to do the pooling. I mean, like if the baby is term, we don't need to do this pooling. There's no medical necessity. But if there is a medical necessity, we need to have a fatwa in those babies. And last slide, the NGO rules is mandatory without charity experience or orphans, particularly those with unknown parents, is very successful and can be used as role model. Fatwa for milk mahram of orphans who's adopted by the allocated families to prove milk mahram is readily available now, as what I told you about it. The best option to do the milk kinship is by breastfeeding the baby by the wife of the couple who will adopt the baby with help of lactation consultant to induce the lactation. If that is not available, a witness, and I already went in details about that. Global health communities, particularly Islamic one, has an ethical obligation to support and promote the health of the individual, babies around the world. This is a shared responsibility among government, medical professional, non-government NGO, and policymaker to establish and enforce robust and collaborative system that ensures safe donor breast milk to be available in everyone. And thank you so much for your, I'm sorry if I took a few minutes from my time. Thank you.
Alhamdulillah. Thank you, Dr. Hanan, for that enlightening and stimulating talk. Unfortunately, in our region, we are following still the human milk banking procedure. So this is really an eye-opener for our Muslim hospital administrator. So thank you for that, Dr. Hanan.